Hey, Dr. Lalaza, this is the video for your first exercise therapy routine. I'll just go over them real quick. You know that each pose is to be held for 1 minute. First stretch is called kneeling groin stretch. Okay, so you'll put one foot forward. Make sure the foot's in front of the knee to start. Flatten your stomach, so you don't want to let your rib cage come forward. Keep that nice and firm back. Your hands on your knee. Press down to engage your stomach, and then keeping your head, shoulder, and hip all in vertical alignment, just move forward enough to get a pull on the hip flexor. Okay, you should feel right in the center of the iliopsoas attachment there. You're just going to hold that for 1 minute. Make sure you don't pitch forward into it or let your rib cage distend like that. We want to really focus on keeping that back. Doesn't matter how deep you go into it, even if it's just a little bit. You really need 10 degrees of extension at the hip to create the right effect. Okay? So first one is kneeling groin stretch. Hold that for 1 minute or 10 breaths. The next exercise I have to do is standing quad stretch. So you can do that facing a wall or with a chair in front of you, anything to help you hold balance. And then you'll grab your knee, or grab your foot rather, and pull your knee back so that it's flush with the other knee in vertical alignment. Pull it back, and then also flatten your rib cage again, just like in the last stretch. Make sure you're not distending as best you can. And then you'll squeeze your butt muscles and tuck your tailbone, so you'll feel a really, really big pull throughout the whole thigh. Try to stand up really tall and keep your knee honestly back in line with the other. We don't want it to be forward at all. Pull it back and tuck and flatten. Okay? That getting there completely will take a lot of work, and it's about training the other leg actually to stand with that level hip, which is what really that stretch is about, as opposed to just pulling on the quad. So the first one, kneeling groin stretch. Second one, standing quad stretch. The third exercise that I want you to do is the wall sit. So you're going to take any strain out of your low back out, and you're going to make sure you have good traction wherever you're at. I'm going to use the floor here. Put your feet hip width apart and make sure that they're pointing straight ahead. Lower yourself so that your knees are right over your ankles, and you sit in that for ideally up to 1 to 2 minutes, pushing your low back flat into the wall and keeping the weight in the heels. Okay, that'll disengage your lumbar spine erectors, and it'll really activate your quads and gait muscles. So it'll be a transfer of work and an elongation and relaxation stimulus for your lumbar erectors. Okay, so that's a great one if your back is feeling tired, just want to give it a break. That's called an air bench, and that will relax your lower back. So the next one is called hip lift. You lay flat on the ground, cross one ankle over the opposite knee, and you pull that up so that it's at 90 degrees at the hip and at the knee, and this foot is flexed towards you. Okay, shins parallel to the ground, upper body palms up, just relaxed on the ground, and this knee is pushing out using the musculature of the hip. Okay, you hold that for 1 minute, and then you switch. Okay, 1 minute. Next exercise, that one's called hip lift. Next exercise is what's called static extension position. So you put your hands forward, shift your shoulders so that they're vertically aligned over your wrists, and your hips are about 6 inches further forward than your knees are. And your knees should also be hip width apart. Okay, you have a tendency to put them too wide. We want them to be hip width. And your elbows stay straight as you come forward, and then you relax your head and shoulder blades and let your spine just droop to the ground like an old horse. But make sure that your elbows stay straight. Okay, head is relaxed, elbows are straight, shoulders are over your wrists. You had a tendency to stay too far back. We want to pitch forward. Okay. Next exercise is cats and dogs. So you'll slide back one hand length, and then you will round and exhale and tuck your head, rounding your spine. Then arcing, looking up, clenching your shoulder blades together. Back and forth 10 times. Exhaling, inhaling, elbows stay straight, and make sure you get that full retraction of the scapula. I had to tap your upper back a couple of times to make sure that you got that last bit. Squeezing your shoulder blades together. Those are called cats and dogs. Next one is downward dog, so you'll tuck your feet up. In cats and dogs that were flat, you're going to tuck your feet up. Then lift your knees up, shift your chest towards your thighs, and then straighten your legs as best you can while keeping your back in extension. Okay? So see how my back is rounding a little bit at the mid-back? I bend my knees, get my tailbone really, really up, and then extend again, keeping my thighs tight, and really pushing my chest towards my feet through the palms of my hands, okay? It's going to help unite extension throughout your whole back, and it had a really great effect on your thoracic back. That was really a big key for you, getting extension demand there. Next one you'll do is called squat, actually, in the Vygotsky method. And you will hold the door handles in your room, straddle it with your feet so that they are directly vertically beneath your hands. And then you'll sit back so that your upper body is vertically aligned at the head, shoulder, and hip, and your knees are directly over your ankles. So there's 90 degrees at the knee, and then there's also 90 degrees at the hip, and your upper body is just sitting directly over your hips. Arms are straight and relaxed. This floor is sliding a little bit, so it's hard to demonstrate as well as the angle, but just sitting back there and make sure that your lower back has a little arch, so you're sticking your tailbone out as opposed to tucking and rounding it in. You hold that again for 8 to 10 breaths. And that one had a really great effect of activating your posterior stabilizers, and it gave you a lot of flexibility forward, which was a big key for you. The next one is going to help level out your extension left to right, or sorry, your weight distribution left to right. And it was windmill, and we did it like this for you. Your heels were against the wall, palms on your hands, first hip width apart, and you'll go 3 to 5 times, bending from the base of the spine really far sideways. 3 to 5 times at that position, hips staying really still. The next 3 to 5 times at this width, arms sliding down, making sure your back of your head stays level, so your chin isn't arcing up, but the back of your head, shoulder blades, hips, and heels are touching the wall. You go 3 to 5 times each way, shoulder width, and then even wider still. Make sure the feet stay really straight in all these positions. 3 to 5 times again. Make sure your stomach doesn't distend out either. It's just staying nice and neutral spine. 3 to 5 times. And then back to that starting position 3 to 5 times. So that was 3 different positions. Hip width, shoulder width, and then really wide. And then back to hip width. 3 to 5 times each way. Then we did arm circles. So you put your arms straight out, feet hip width apart. And you're going to clench just your knuckles, okay? Don't make a fist. I just want you to clench the knuckles, okay? Wrists are straight, thumbs are sticking out forward, and then you squeeze your shoulder blades down and together. But when you do it, you don't distend your rib cage, you just squeeze your shoulder blades. Just squeeze them down and together, and then you'll circle forward 40 times with your feet hip width apart, shoulder blades clenched, and then 40 times backwards. And then your last one, standing overhead extension at the wall. Pull your arms way up, head, shoulder blades, butt, and heels touching the wall. And extend it and try to make sure your elbows stay really, really straight as you do that. And hold that again for 10 breaths. And then check in with how your weight feels, and that's your routine. Do it once a day. And then if you find yourself slipping out of position, repeat any of the exercises to get you back to that posture frequently throughout the day. Okay? There you go.